Thank you, Premier. So an ongoing slow and steady decline. It is heading in the right direction. It's too slow for all of us, I'm sure, too slow for me, but it is going in the right direction. It is some light at the end of a very long tunnel. The cases in Colac are the only regional cases today, so we will, I'm sure, see a continued decline in the number of active cases in regional Victoria and a lot of local government areas in regional rural Victoria that will not see further cases. That said, there might be cases out there, so do not be complacent and think that there isn't a possibility of cases being introduced into your postcode if you're in regional Victoria. Get tested if you're symptomatic. In Metro Melbourne, the cases are concentrated in just a couple of dozen local government areas. So again, there is a focus in terms of where transmission is occurring, but single cases occur pretty broadly across Metro Melbourne, and anyone can move across Melbourne for essential purposes, and so there is always the risk that even if you're in a local government area that has no cases or very few cases, that cases can be introduced there. So again, if you have compatible symptoms, a runny nose, a tickly throat, headache, cough, fever, please get tested. We've seen reasonable numbers of testing in the last couple of days, but we do need to keep that up. We need to understand where every single case is across Melbourne and the whole of Victoria. We'll take questions.
Professor Sutton, which of those local government areas are you seeing those clusters still in?
So they're still in the north and west suburbs of Melbourne, as well as concentrated around Dandenong and Casey local government area. But it's a handful of new cases each day in all of those local government areas, so it's not huge numbers. We know it's not huge numbers. We've got 64 as an increase today with the reclassifications, but those few cases are spread out across the north and west and the southeast.
Professor Sutton, we're going to have 2 more weeks of stage 4 restrictions after the 13th of September.
We'll be talking about that tomorrow.
64 new cases with the reclassification, only one is a mystery case. How many of those new cases are in healthcare workers and aged care workers?
So I can't tell you for the numbers that have just come through overnight and late yesterday, but the healthcare workers make up about a third of our totals in recent days. So that's aged and acute care and disability. Although the disability sector's really seen very few, if any, new cases and a decrease in active cases. About a third are close contacts of known cases, and the remainder are under investigation or mystery cases. But the mystery cases are about 10 or 15%, remain at 10 or 15% in recent days. And if today's numbers keep that trend going, it'll only be half a dozen.
You said the decline is too slow for you. Can you expand on what you mean by that?
I have the same desires as everyone else in Victoria and across Australia. We want to see this disappear. We've been so very patient, but it is hard yakka. There's no question for watching it come down from 725 on one day and to see it drop by 100, but to get to these smaller numbers and to see it only drop by 5 or 10 each day, I can understand that impatience. I feel that I'd love to see it drop much faster, but these are the most difficult chains of transmission to get on top of. That said, there are still preventable transmissions occurring. So, people who are gathering who shouldn't be gathering together, that's causing little clusters. And if we can get on top of those, they're 5 or 10 cases each day. We could get on top of this even faster. So yeah, I've got some impatience about not being at zero, but I am realistic about the fact that there are lots of efforts that need to be made across lots and lots of different areas to really crush this.
Is there a point where health authorities just accept that we won't be able to successfully suppress the virus below a particular number? Is there a time frame, or is it just see how long we can go until we can get it below, say?
Yep. We have to live with the reality of what we can achieve. We know that we're doing absolutely everything. If we get to a low number and it doesn't disappear, we will just work to keep that number low in the long term. But we have to get to a number that is sustainable to suppress in the long term. Because as the Premier says, no one's looking for a third wave, no one's looking for another lockdown, and we absolutely need to get to a level and keep going until we get to that level that we can be confident that we're keeping it there for the long term, for months and months.
What's the situation of delayed gratification? If we really knuckle down for another couple of weeks, we're going to win?
Yeah, we're on the winning stretch now. There's no question. This is the last gasp of the virus, and we need to work harder than maybe we've ever done before to make sure that that last gasp is indeed the last one. Because being on the other side of that, there'll be significant rewards. It's not, this is not behave yourself or else there are no rewards. This is just the reality of this virus. If we can do everything that's required now, we will drive those numbers down and we will get to a point where we can keep them down.
What is the current reproduction rate?
I don't know. It hasn't been calculated again in recent days. I think I said yesterday it's not so significant when we're down to very low numbers. It can have a very broad range in terms of the calculation, but I think it's around the 0.8 mark. There are calculations that are done by different modellers. They've all been in the 0.8, 0.85 kind of range, which means it continues to go down.
There are calls from some epidemiologists today to have a two-pronged approach. They're saying that you can't keep all of Victoria locked down when the spread is largely between healthcare workers and their immediate contacts. What do you make of those calls for a two-pronged approach?
Well, it's not incompatible with what we're doing. We have a strategy that's absolutely focused on aged care. That's what the ARC is working on. We have a strategy that's working on healthcare transmissions that is entirely focused on the actions and implementation that's required there, and we have the broad measures for community transmission. So they're all being put together as part of getting on top of this. And as you know, there are separate roadmaps for rural and regional Victoria and Metro Melbourne. So they'll all be focused appropriately based on the specific challenges. That's true for the kinds of transmission that are also occurring in high-risk workplaces. They are each tailored to the particular challenges of those transmission settings.
What they're actually calling for, though, is vastly different to what we currently have. They're saying let everybody else effectively open up and move somewhat more freely while healthcare workers are still monitored and aged care workers are still monitored closely. It is very different to what the vast majority of Victorians are currently doing.
Well, certainly from the epidemiology that I've seen, there is no definitive dividing line between healthcare worker infections and community transmission. Community transmission means that there are patients. Patients put healthcare workers at risk potentially. They certainly mean that staff who work in aged care can become infected and can bring virus into aged care settings, so that you can't just separate the relationship in transmission between community transmission and those other settings, and it works the other way. There are aged care workers who can take the virus back to their families, and their families can take it to others in the community. That has happened. So we need to focus tailored responses, but we have to recognise that they are all interlinked.
Professor Sutton, can you just confirm how many how many Victorians have died in aged care homes? I think it was 505 yesterday, so it could be something like 515 today. And out of the
it is 515 today. Yeah.
Okay, so that means that 78% of Victorians who have died from coronavirus have died in aged care homes. Now we know this, and it's been all year basically that we've had this coronavirus. Do you think the strategy going forward should be just putting all our efforts into protecting the vulnerable in aged care homes, and at the same time really working on opening up for businesses who are struggling? So I know you previously said that the COVID doesn't really transmit as much in cafes as they do in households. So seeing as lots of cafe owners are struggling at the moment, do you think now the strategy should be getting them to open up and just putting a lot more effort in protecting, I suppose, aged care residents?
There's no question that we're putting a huge focus on protecting those in aged care. It's also important to understand that the real epidemic in aged care followed the epidemic in the community, and the number of new introductions into aged care facilities happened at the height of community transmission. And so getting on top of community transmission is protecting aged care settings. It's both the response within those settings, so making sure that it doesn't spread amongst residents, it doesn't spread amongst staff, and it doesn't go between staff and residents. But it's also about keeping on top of the numbers in the community, because the aged care outbreaks followed community transmission, and they're now a challenge to make sure that it's not reintroduced to prolong community transmission. So yes, there'll absolutely be a focus in aged care. In terms of how we address risk in all workplaces, we are absolutely using those principles of what are the regulated environments that we can look at, where we can capture names, where we can make sure that people are spaced appropriately, where we can make sure that issues of ventilation and cleaning are all addressed. So those principles are absolutely being applied, and we recognise that indoor is more a risk compared to outdoor, where people are forced to be closer together. It's more a risk than those places where they're separated. Where there is a chill room, where there is high humidity, where there is low ventilation, they are higher risk. All of those principles have been applied as Department of Jobs has looked at the risk across workplaces, and we'll use those principles to determine how we move forward.
So is it true or even likely that hospitality venues won't be allowed to have indoor dining until there's been 2 weeks of zero community transmission?
Well, we'll speak to the roadmap tomorrow.
Is this 2 weeks of zero community transmissions realistic and achievable? I know WA's had a long stretch of zero community transmissions. Are there many cities around the world that we're seeing that that's happening? And the second part of that question, when do you think we might be able to get to that point?
I'm not sure when we'll get to that point. We're aiming for it. There's no question we're aiming for it. We may or may not be able to get there. We'll make judgments as we see the numbers each and every day. There aren't many places around the world that have got to those low levels. Most places around the world are dealing with thousands of cases at the moment. 25,000 cases in Spain a couple of days ago. I saw 8,000 in France on a daily basis. That's hugely challenging. If you reflect on what 700 cases a day meant for Victoria, you can recognise what that might mean for other jurisdictions internationally. So they're not at the kind of levels that we're getting to and that we're pushing to, but they're also not under control in terms of the transmission that they're seeing.
Can I just ask, why are you aiming for zero community transmission when it hasn't really happened that much around the world? We've been in lockdown for such a long time, so many people are struggling. Do you think it's really the most realistic aim?
We are just getting to a position where we get low enough numbers that we can sustain those numbers at the lowest possible level. It's not to say that we won't progress with relaxation of restrictions with some small numbers of cases. As long as we can sustain control of those numbers, that's the principle. The long-term sustainability of those numbers, that's what we're aiming for.
Experts and epidemiologists say that for moving between stages as opposed to setting dates, we need to move to thresholds of case numbers and things like that. Is that something you've been considering? Is that something we might see tomorrow as part of the roadmap?
There are certain considerations about having a threshold that relates to numbers, but it's not the only consideration. But absolutely, we're making those judgments on a daily basis, and we've always said that we're looking to get numbers to a certain level where we're reviewing them and looking at where it's headed and where it's at to be able to make those decisions. So, it's not about absolutely fixed dates for everything, for sure.
Is there a risk with those thresholds, genuine question, that people might say that you say we need 5 cases over a fortnight to move out, that people might avoid getting tested as much?
No, I don't think so. I think people understand that getting tested is the pathway out of here. Getting tested is how you identify cases and control this. Not getting tested is the equivalent of putting your head in the sand because transmission carries on. It'll be identified as people present to hospital, as people die. So there's no escaping the reality of transmission. Testing has to be the pathway to get on top of the cases that we know about.
Right, do we know how many patients in hospital for other illnesses contracted COVID-19 there and potentially passed away as a result?
No, not in detail. I've asked the intelligence team to look into that, but it's a metric that we need to look into every single case acquired in healthcare to understand.
Premier, just a question on the. Can we ask you a question on the? Sorry, Greg. Is it first of all, is it a change or not? And what are the rules now?
So it's not a change in the public health directions. There's no new written directions, but there were questions asked about whether parents can go out with their child separate to their own exercise, and the clarification is really around that, and the answer is yes. For those parents who don't have an opportunity otherwise to bring their kids out as they're entitled to, for whatever reason, commitments at home and with work, then they can have that time with their kids in a park or whatever for an hour, as well as an exercise period, again following the rules for themselves.
And I've got one more from mothers and fathers. I know we're opening the roadmap tomorrow, but our playground's going to be open.
You will know very soon. You will know very soon.
Professor, we learned in the draft report on Thursday, we know it was a legitimate draft at some point, the idea of bubbles for individual people living alone, but also for home visits, picking one other household was discussed in that plan. Can you talk us through the logic behind that?
So again, we'll make announcements tomorrow. I haven't even seen the draft that you're referring to. I don't know if it's accurate or not. But the principle we've talked about is that you limit the number of people that you interact with. That's a lower risk than opening up to a different individual every day. That's the bubble principle. It's been under consideration. It'll be spoken to in time.
How can you enforce something like a bubble system?
Look, a lot of these aspects rely on people knowing what the right thing is and doing the right thing. Of course, there are instances where people have reported on behaviours that aren't up to scratch, or people being found out. But there's a significant part of everything that we're achieving, which is just people knowing what the right thing is and doing the right thing, and that's half the battle. And Victorians have done a superb job in that regard.
Just on mystery cases, is there any consistency to the type of people that are catching the disease from an unknown source in the community? Are they mobile workers, for example?
I would have to come back to you on that. I don't know that I've got it all in front of me. I think they broadly represent the same demographics that we're seeing in all of our cases. But obviously the cases that are linked to outbreaks have the professions where those outbreaks are occurring. So they are in aged care, they are in the higher risk industries. So some of the other individuals might be similar in terms of location, in terms of age group, but they won't have the same work demographic details.
How many of those mystery cases did we have over the last week?
So it's been around 10 or 15%. So, if you're looking at under 100 cases a day, it's in the 10 or 15 numbers on a daily basis.
On mystery cases, so when we went into, I think I've asked this before, but just when we went into...
You may.
Just how do you feel about them? Because when we went into stage 4 just a month ago, there was 760, and I know now it's well over 4,000. I think 400. Was it 4,200? How do you feel about it?
Well, we're driving them down. As we're driving total cases down, those mystery cases are being driven down. The focus on them from a epidemiological point of view is that we need to try and understand where they might have acquired it as much as we possibly can. That's clearly apparent for clusters and outbreaks where we can see that where people have picked it up, contact with a known case. But for mystery cases, we really want to explore where they might have gotten it from. And there is serology testing, so the blood testing, not just the swab testing, where we can look at the people that they've potentially acquired it from, the people that they've been in close contact with in the 2 weeks before they became unwell, so the acquisition testing. And you can do blood tests, and it might be family members who never really developed significant illness, never got tested. It might be workmates. And if you can do serology testing for them and understand that that's where they picked it up, then you can do broader testing in those settings. So it is important to try and dig down to those mystery cases as much as possible, but they're coming down as the total cases are coming down, and they will be, they'll be subject to the same pressures that reduce transmission as everyone is. So the limitations in movement will limit the mystery cases in the same way.
So do you think we're in a better position than we were a month ago, even though we've got 3 times more number of mystery cases recorded?
Yeah, they're just the mystery cases that have been gone through that full investigation, so that we understand out of our total which ones are the mystery cases. But we're unequivocally in a better position because we've got single figures that we're heading to for mystery cases. That's a terrific position to be in.
Brilliant. People who live alone in single-parent households are struggling is something you've spoken about before. Do you want to give them any hope ahead of tomorrow that they'll be looked after?
Only to say that we have always been cognisant of those struggles. We've always done this really difficult balancing act, understanding that we have to drive transmission down to the fullest extent possible. That's why these restrictions have been so strict, because stage 3 restrictions were turning the curve, but weren't doing enough, and we would have been in a position today where we'd still see hundreds of cases rather than double figures. And so those struggles for single parents, people living alone, are in our minds, absolutely. But we are balancing the need to control transmission to the fullest extent possible with a recognition of those really significant struggles. So yes, we've heard people. We're working through all of the next steps with those struggles in mind, as for many other sectors, and so if I can give that assurance that that's front and centre in our thinking, and all of the other struggles for people psychologically, I'm happy to give that assurance.
Professor, you said before that Victoria's potentially got the hardest task ahead of it. Is it safe to say then that Victorians shouldn't really be expecting any sort of significant easing of restrictions tomorrow? Not tomorrow. An announcement of easing of restrictions for the next few weeks. They should brace themselves for a few more weeks of pretty hard lockdown.
What I really mean by the hard task is that it's holding the line. When we get to very low numbers, people might consider that we're through it, that we can change our behaviours, that the risk isn't there anymore. And so the really hard efforts that I'm referring to are the efforts of bearing in mind that until we're really through this, that the risk will remain, the risk of resurgence will remain, and that will be awful for everyone should it happen. And we have to have that. We have to have that steady approach to be able to get there. And that steady approach is not just what we map out, but how people respond to it, how people ensure that they're still wearing a mask, ensure that they're still getting tested, ensure that they're still isolating as soon as they're unwell. That's what I mean by the hard yards ahead of it, because there is, at an individual level, there must be a sense that you just want to get back to normal. And so I just say hold the course.
Is there a worry then that when we do get through it, so to that point where you just referred to, through the worst of it, that people will then go berserk, and we will see cases, we've seen New Zealand, get to zero and then come back, and the same sort of happen around the country. We've seen cases pop up. Is there a concern then that because we've had such a long, hard lockdown, people will actually just go nuts?
I guess there is a concern. I have that concern. I don't think it'll happen. I think people understand. We've been through this. We've gone through a first wave. We were on the other side, and it all came back. And so I think people understand how awful it is to have a resurgence and what it means for our health system, what it means for our economy, what it means for our individual lives. And so I hope that's still in people's minds, and that there isn't that immediate push to just normal behaviour, because that does put you at risk as an individual, puts all of us at risk.
Just on that, how confident are you that this is kind of the tail end, and that if we do keep with this strategy, then there won't be a third wave when there has been cases pop up around the world and around Australia, and we might not know about it.
Yeah, everything we're doing is working on that principle, that this is the tail end, that we are working to a future where this virus remains under control for the long term, because we can't afford it, no one can afford it globally to have a huge resurgence. So we need to keep it under wraps until a vaccine is available. There are over 30 that are in those phase 3 trials with tens of thousands of people, hundreds of thousands of people around the world now going through phase 3 trials where we'll see what a vaccine might be able to achieve. And if just one of those vaccines, and there will probably be 3 or 4 or more of those vaccines that show effectiveness, that are safe and can be produced, that's what we're hanging out for. And so if we can do that and hang on for those months ahead when a vaccine's available and can be provided across the population, then we're all in a much better position.
We haven't been able to control the virus for most of the year, so there's no doubt in your mind that that this will happen again next year.
I think we still know what works in terms of control. We've seen it get away for sure, but we also know that these numbers that are going down day by day are in response to the very things that we have in place now. And we know that the contact tracing system is stronger than it's ever been and more timely than it's ever been. We need to work on all of that. We need to work on getting numbers down further. But yes, I'm confident that when we get to those single figures, that they'll remain there, if not go down further.
This roadmap is people's mental health and I guess the invisible effects of a lockdown being taken into consideration, because obviously Melburnians, Victorians have been in lockdown for an extended, long period of time. Are you concerned that an even bigger extension would have a more significant effect on that, and are you considering it in this roadmap?
Yeah, absolutely. The effects on mental health. We've talked about the risk of domestic violence. We've talked about access to medical care. All of those things are in mind. And of course, all of the consequences of not working, of not having the economic activity that supports people's lives and livelihoods. So yes, all of those things are in mind. Safer Care Victoria, our Victorian Agency for Health Information, Cabinet more broadly with all of their relevant departments are looking at those data metrics and hearing the stories, not just numbers on a page, but knowing the very real effects of this. So yeah, it's in mind. It's an absolute consideration.
Can I ask the trivia question, please? The federal government put out